politics, business, sports, arts, music. Mike and Marty on the beat. Mike and Marty. Mike and Marty on the beat. Mike and Marty. Mike and Marty on the beat. Mike and Marty.
Welcome, Bellows Falls and Keene, and welcome to the feed. It's Mike and Marty. We're back for the new year. Today we're here with Dr. Taronte Venable. He's a brand new chiropractor here in town, and we're going to be talking about him and his practice and how he ended up here in Bellows Falls. But first, Marty, with local events.
Local events. So if you haven't had a chance to see Avatar Fire and Ash at the Bellows Falls Opera House, this might be your last week. I guess it's been there since we last did the feed last time. But it's only staying through January 13th. So that's your last chance. Also happening at the Opera House, happening this Thursday night, is the first of the Ray Masuko concert series, and it's called On a Winter's Night. It's 4 singer-songwriters. It is Patty Larkin, Cliff Eberhardt, Lucy Kaplansky, and John Gorka. I did check ticket availability, and there are tickets available, but it is a pretty full show. I think
It's a classic Ray Masuko.
Yeah, it is. The whole singer-songwriter genre. And then speaking of classics, thank you for the segue. The classic movie is The Producers, which is a Gene Wilder movie produced by Mel Brooks. I don't think I've seen this one.
Really?
Springtime
for Hitler in Germany? That was it was an amazing
movie.
movie.
I've seen it. I don't know. Maybe I just don't remember it. But anyway, that is sponsored by none other than the local Edward Jones office and Mr.
They
William
have good
Stevens.
taste.
They do have good taste in movies. They have good taste in wives too.
A little inside joke here.
So welcome.
Thank you. Thank you for having me.
Thank you for coming. So you are in Dr. Temple's practice, Dr. Temple's space.
I don't know if it's Dr. Temple's practice.
Well, that's what I was just going to say. But now, even though it's still Temple Chiropractic.
Yep.
So just tell us, how did that come about? How did it work?
Okay. Well, long story, short story. But I'll try to be brief. I first got into chiropractic mostly because I was a very athletic child. So at 5, I started singing, doing gymnastics, a lot of sports. Ventured into winter sports actually in middle school, and there's a point to this, by the way.
I'm sensing there might have been an injury.
Yeah, there was an injury. So I did figure skating, I did snowboarding in middle school, and then in high school I partially tore my ACL. And at that time there was just one moment where I was in the bathroom literally sobbing because I couldn't actually tie my shoe. And shortly after, I started physical therapy with a sports therapist, and immediately realized that this is what I needed to do with my life. I really like the idea of being there for people in that moment, because it's just so devastating when you find something that you just can't do anymore. You literally took for granted at some point. So fast forward, went to undergrad, worked at a physical therapy and chiropractic outpatient office for about 3 years.
Where?
In Maryland. So I'm originally from Gaithersburg, Maryland. And that's I'd say it's a small town, but it's definitely not compared to here.
By Maryland standards, it's a small town.
Yeah,
but by
it
Vermont
was.
standards,
So it's very much more developed now. But I worked at a physical therapy and chiropractic outpatient office, and at the same time worked at an inpatient physical therapy department as a physical therapy tech, and also a personal trainer for that original practice with the chiropractic and physical therapy outpatient for patients that were kind of nervous to get back to what they were doing. And in that process, I discovered, I was chiropractic is really cool. I like the idea of being able to adjust joints, get people feeling better, and if people aren't into adjustments, there's other things that we can do. Then went to grad school. I actually got a specialty degree in neurology, so that is a whole nother program that we could always talk about. And then I also, just a glutton for educational punishment, but I also went to a program from the Prague School of Rehabilitation for dynamic neuromuscular stabilization, which is a whole functional movement thing. So anyways, got out of school, didn't want to work 3 jobs like most people in my family, because I was one of the first to go to college and first to go to grad school. And I was like, I want to work one job. So I thought, let me go to New York City. I'll make more money there. But you know, being an Eagle Scout, actually, I did all that
Wow,
too.
good.
I really missed nature and being able to go hiking, kayaking, snowboarding, all that stuff. And my in-laws are actually in the Monadnock area. So for the last 8 years, I've been coming up to this area
Oh, nice.
for all of that. And my partner and I were like, you know, we should move up north at some point. Opportunity presented itself to do that. We left, moved upstate New York, and as sometimes plans do, things did not work out the way as planned. And I found myself in a position with a mortgage and needing to figure out what I was going to do next. So I kind of jet-setted a plan and just seeing what was out there. I saw there was a practice for sale in southern Vermont, and it turns out it was in one of the only other towns I knew of. They were like, Bellows
There you
Falls, and I was
go.
like, oh, I know where that is. At Dr. Temple, and like immediately just very much resonated with him. I can say that like when it comes to like working for another chiropractor, there are times where you blend or you don't blend. And I could tell immediately that Dr. Temple really cares a lot about his patients, and that's the way that I like to operate. Like, you come first, my ego's out the door, whatever you need is what we're going to do.
Yeah.
And I could tell that he's the same kind of person. So that opportunity led into discussing how would I buy the practice, because I was not ready for that. And I worked for him for a year, saved up enough money for the business loan, and here we are as of April of last year.
Nice.
I now own
That's
the practice.
awesome.
Well, congratulations.
That's
That's a great story.
Thanks.
And he's still helping you out, I hear, so he's
Yes.
still available.
Yes, he's still there Tuesdays, Thursdays. I'm working Monday, Wednesday, Friday, and the arrangement there is just basically we're just keeping things smooth, and I also want to honor the work that he's put into the business
Oh, yeah,
itself.
because he's been doing it for a long time.
Yeah.
I was intrigued. I went onto your Facebook page because as we talked about before the show, I'm a bit of a chiropractic junkie. I do like all of the different options with chiropractic, which we
Yeah.
will talk about the fact that there are options.
There are options.
But I liked, if you'll indulge me, I just wanted to read what you put on your website. It states your ultimate goal throughout treatment is to treat the pressing ailment and address the root cause.
Yeah.
And I'm a huge believer in that. The root cause of the problem by discovering what predisposed the body to the injury or the pain. And I think that if anyone takes anything away from this show today, it's that is what's going to get you relief if you can find the root cause. Otherwise, you just mask. You can treat symptoms, but if you don't treat that root cause, it's not gonna go away. It's not gonna get better.
Exactly. I'm very passionate about that. I've always loved puzzles as a kid, but mostly just trying to look at everything as a whole, because it's so easy to get distracted by like the pain or like that spot or the thing you saw in the image, and not what you're seeing is not always what the root is. That might be part of the symptom, but how did it get there? Why is that joint getting worn down with arthritis? And a lot of times it comes to kind of taking a look at lifestyle, taking a look at the muscles and how they're working. Where is it weak? Why is this tight? Why is it compensating? And at least giving that a good go. With evidence-based rehab, I can't call it physical therapy because I'm not a physical therapist, but it is evidence-based. And then sprinkling in a little bit of my other tools, depending on the situation, what's more appropriate for the patient.
That was what fascinated me too, is you have a lot of tools in your toolbox.
I have a lot of tools.
And that's because I think from a perspective, I think things are changing, but I think at one point, chiropractic was kind of considered, for lack of a better term, woo-woo.
Yeah.
And people think of it as kind of only one thing, and it's so much more.
Yeah. There's actually two different kinds of chiropractors, depending on where you go to school. I don't know if these are official terms, so don't quote me, but there are straight chiropractors and there's what we consider mixers. And straight chiropractic is a school of thought that's originating from the original principles of chiropractic, which is where the spine is aligned and everything will heal itself. And then mixers are individuals that are still chiropractors and still practicing chiropractic kind of principles, but integrating that with whatever kind of recent evidence is out there and kind of adding other tools to that toolbox. I consider myself a mixer.
And what other tools would you say you use then? I mean, for just an example.
Yeah. So I mean, this is a good moment for this
Gave you
little
a segue.
tool. So this is a new tool that I
Uh-huh.
just got. This is the LZ30 laser. Not like lasers from like I don't know, what is that?
Laser
Austin
tag?
Powers.
Oh.
Yeah, awesome.
Yeah. Lasers
Laser
on the-
sharks with
Yeah.
the lasers on their heads. Yeah.
Big
But,
reference, I
not
like
the-
it.
Not
Just to
that.
be
Not
clear.
that.
Not that. No, we're not drilling holes in anybody. This is both infrared and red, and what that does is it's kind of like an usher in a movie theater. It like when you're shining that on a spot, it kind of tells cells that they need to go here and pay attention to this area and help it heal. It also helps kind of usher out some of the old cells and replace those with new things. And at the same time, while it's, let's say, providing this frequency of energy to the body, it's also giving that energy to the cells so that it actually can accomplish more. So it's like dropping a little care package and being like, hey, look here, and here's the stuff you need to get that done.
I was gonna say, does it then enable the cells to do what they're supposed to do to clear
heal.
whatever they need to clear to heal?
Exactly. So it's FDA approved for like inflammation and pain.
So how does it feel? Does it feel warm or does it?
I would say it
'Cause
does
infrared?
feel warm, and
Yeah,
the
yeah.
infrared. I think more of the warmth comes with the red because that's a little bit more surface level. The infrared's going actually deeper into the tissue, and that can sometimes feel like warm, but also like icky isn't quite the right word. It's a very
Tingly,
interesting
so, yeah.
sensation, but
Oh,
it's not
interesting.
painful.
Uh-huh.
Not at all. Just a little weird sometimes,
Yeah.
but also you can also, as your body's healing from this, you may have a little bit of soreness, but that's entirely normal. And there's definitely a lot of protocols that Dr. Richard Amy, who founded this particular product and also the original FDA approval for low light level therapy is what this is called, has also set a bunch of protocols that are standard today and for different attributes.
And what would be a typical ailment that someone would come to you for, and that would be your course of,
Honestly,
or is there not a typical? Is it just a
there
case
is.
by case? Okay.
There is. I mean, it's definitely, I very much love to do individualized care. So it really does depend on the situation. But where I stand with this right now, it's not something where I want to kind of just pull this out at the beginning. This would be something with someone who's a little bit more complex. Maybe they're hypersensitive from chronic pain. Infrared has a lot of research around dealing with chronic pain and reducing inflammation in that situation. So that's great for that. People that don't want to take pain meds for forever, something good to at least give a try.
Yeah,
It
yeah.
does work over the course of like 4 to 3 weeks, 6 to like 12 sessions, and then as you continue to do this consecutively, it also builds up in the body. So it actually stays active for around 3 to 4 months, depending on the condition. With more chronic things, maybe we're looking at kind of doing a little supportive dose periodically, but something that's maybe more acute and just healing, hopefully by the time you're done with your sessions, you're done.
And other than it being a little warm and maybe a little tingly, there's not a repercussion, it doesn't cause a chain reaction of something else?
Not necessarily. There is some mixed research about it in cancer, and that's really the only kind of, let's say, contraindication with this, is that there, in some cases it helps, in some cases it causes things to proliferate. So that's another reason why this isn't like my first thing out of the
Right.
gates.
Yeah.
And something that preferably I'd love to have some imaging of the area first, just to make sure that we're not doing anything that we don't need to do.
You mentioned like, someone taking chronic pain medication.
Yeah.
Like that definitely has a repercussion.
Right.
So if
exactly.
you can, I'm path of least resistance kind of school of thought. If you can go with the path of least resistance with the least number of repercussions,
Yes.
and it works, awesome.
Yes.
Or if at least it alleviates it, because I'm curious about like, would that be a treatment for fibromyalgia? People that have had that and like they've tried everything and it.
Yeah, this is definitely something that can help with that form of inflammation. I would have to admit that because of how the FDA has things approved, that would be considered an experimental kind of treatment. So just making sure that, like, one, we've checked the right boxes, we know what this is, and making sure that they're, well, I guess by they, I mean myself, and following what that research is saying is the appropriate kind of protocol for this
Yeah.
situation.
I was just curious. I see a lot more on well, people on Facebook, and I just see that come up a lot more, which is
Yeah.
interesting in and of itself. Like,
Yeah.
where did it come from? And I know it's hard to diagnose, and I know, and why all of a sudden, and
Yeah.
that it seems like the people that have it really are quite debilitated. So.
Yeah, and they're finding more and more that debilitation is kind of stemming more and more from inflammation in the body. They're still, we're still trying to get that deeper understanding as to the why. But dealing with inflammation is what this thing does best. So it would be really helpful for those people.
Nice.
Yeah.
So what other things do mixers do?
So it depends on what the research says and what your certifications are in. But speaking for myself, I also do, aside from evidence-based rehab, a lot of what I like to do is kind of give you the tools you need. So you're coming in, you got this pain, we go through the exam, we explain, me, I'm not a royal person, so I can't go with the we. But I like to make sure that you understand what's going on. So we do the exam, we figure everything out, I explain everything to you. So like, this is the diagnosis, this is what that means, these are our options. I never want to have anyone come in and feel like they're obligated to do something that they're not comfortable with. So especially with people who've never done chiropractic, I try to out the gate say like, look, if you're not comfortable with what we're doing, just say so. It's not a big deal. My ego's not in this. I'm just here to support you. So mobilizations are another thing that I can do with joints instead of just cracking. There's a tool called an activator that delivers a little gentle kind of push. I like to use those for patients that are either sensitive about the adjustments or even people with osteoporosis. Like sometimes a manual adjustment is not the best idea. And basically the least amount of harm. So there's that, the home-based exercises, the functional movement stuff that I do, that's case by case. A lot of times I'll use that for athletes or people that have an intricate job or something they need to do. And we can use that to integrate the spot that we're focusing on to the rest of the body, because nothing just works by itself.
Right.
And then a whole lot of other tools. Some manual work, something I do in some cases. It really depends on what someone needs, but I should remember to do plugs. If you go to my website,
Yes.
Well, we were going to ask, how would we reach out to you? That was the next question.
yeah, oh, perfect. Maybe I'm psychic. So if you go to my personal website, that has a lot of the information of the various tools that I have in my toolkit. Some things we have in the office, some things we don't. And that's www.tarontevenable.com, and you can see my name below. For the practice specifically, you can go to templechiropractic.org. Some of our tools are listed on there as well. And then if you're interested in learning about some other aspects of my life, which is my singing career, you can go to at the Venerable Doctor. That's not a misspelling. It's a VENERABLE Doctor at Instagram, or not at Instagram, but you know where I'm going with that. The Venerable Doctor on Instagram.
Nice. So, one of the things I think that's always important is, so I'm going to guess that somebody maybe watching the show has never even, like, they're maybe nervous about even walking in the door. So can you kind of talk, you said you have an initial exam and you gave a little hint, but can you walk us through the process? They call, they get an appointment, they come in. What does that then look like?
Yeah. So you came in for your appointment. There's the great paperwork endeavor that comes through, which provides a lot of information. And it is our duty to kind of talk about, like, what are the risks, what are the benefits of treatment. We also discuss that during the exam. You come in, I first start by going through your medical history, because you never know, some of these like shadowing things are like, that's not related. And then it turns out that I'm like, yeah, that's actually could be related. So we go through that first. Then we go through your story about what happened, what brought you in. And then after that interrogation, we go through the exam. And the exam is pretty thorough. I'm looking for red flags. So the things that you're afraid of happening when you get adjusted. I've been fortunate enough, and maybe not as fortunate for the patient, to discover some people that I'm like, oh, we're not touching your neck. You're going straight to getting some imaging. We need to figure out what this is. So we look at all that scary stuff first. And then we're looking at the muscle strength. We're looking at your range of motion without discomfort. And then I'll do some standard orthopedic tests to figure out where stuff is coming from. In some cases, if it's a neurological condition, that's a different kind of exam with the whole functional neurology specialty, which I forgot to mention. But that is, we do a more traditional kind of neuro exam. And in that, I'm kind of looking not just for like where you're failing in the test, but I'm also looking for like what's the quality of this performance, because that can also tell me something about how different areas of the brain are functioning and firing.
And give me an example. Go deeper with that.
So like, I think the most common example would be like post-concussion syndrome. So people who have had a concussion and they've had symptoms that have lingered longer than 3 or 4 weeks. That's where we're starting to get into that post-concussion kind of criteria. And then what I'm essentially doing is going through the brain structure and your brain stem, figuring out how things are working. Is there somewhere that's not firing so great? Is there somewhere where you're performing poorly? And then is there a way I can use an indirect pathway or a different part of the brain that does fire well to talk to this spot to get it to fire better? So brain exercises essentially. And sometimes lifestyle plays a role into that too, but I try to kind of go one variable at a time. I don't like to like inundate like a shotgun approach where it's like, let's do everything. I'm like, no, let's start here. See what we get. Yeah.
So it's not scary.
Yeah, no. I try not to be scary the best I can.
I just think that, you know, it's one of those things that you kind of have an image in your head, and because and I don't know, it's also like not. You also have to be participatory in like you go into your doctor.
Process,
Usually, a lot of times when you go into your doctor for an exam, they kind of talk to you, but you have to be more, and you sometimes have to. You'll learn tools to help yourself,
Yes.
which I find empowering.
Yes.
But some people find that prohibitive. But at the end of the day, sometimes it's the best path if you can help yourself.
Yeah, and I try to accommodate the individual. So like if you're someone who like, I can't do exercises on my own, I'm like, cool. Maybe at the beginning I see you a little bit more often,
okay.
we do it together, we establish that habit, and then I set you free and you fly on your own. Or maybe we have to just make it like accommodate just who you are as a person. Maybe you only have 5 minutes. Fine. These are your most important movements to do. We're not calling them exercises anymore.
There you go.
Yeah.
There's the semantics
Yeah,
of it.
right.
True.
And like you do these movements and focus on these, let's see what we got, and we kind of go from there. Or maybe I'm referring you to physical therapy because you really do need someone to be with you that entire way. I'm all about like whatever works for that person, and also working with other practitioners as well to make sure that you're getting the best care you can get.
Great. Would you say that with your background and with all of the schooling you've gone to, you have a real strength with sports medicine? Because it seems like that's almost where you were rooted. And do you
Yeah.
find you still tend to do that, or?
I honestly, I don't have a lot of sports people coming through.
Well, that's
the
why I was
office,
wondering. It
But
seems
I knew that's where you were going, because we are a very sports-oriented town here.
I see. Okay,
Yes.
gotcha. So it's very
So
advantageous for me
It
to
would be good
here.
for people to know that there is a good
Yeah.
Yeah,
a
there's
resource
other
for injuries.
there's
Yeah.
other options besides just whatever.
Yeah.
Cutting your way through it, or
Yeah, very true. And like I would dare to say that life is also kind of a sport. I mean, there's a lot of people that like have farms out here, and like teaching you how to like squat properly, to lift. I learned the word for this. A box? Was it a box for a bale of hay? Or well, now I failed. But anyways, I learned a term yesterday from a farmer for what those are called.
Oh, really?
But yeah, lifting that is also still a sport. You're practically powerlifting every day.
right? Yeah.
Except a lot of times people are getting used to the idea that like, oh, well, I did this hard thing, so I must hurt. I'm like, well, no, you shouldn't hurt from doing lifestyle stuff. So
Right,
let's
right.
cater treatment to support you to be stronger, to be able to do that activity.
Yeah.
So I'd say, yeah, I do the sports, but it's
Yeah,
life that
it's
we're really
everything,
training for. Yeah.
So let's just do a quick recap, because we're down to just about a minute.
Okay.
I know it does go by fast. We
does
told
go
you.
by
So what's the best way to get an appointment with you? Is to just call the office?
You can call the office at 802-463-9522, or you can email the front desk at theoffice@templechiropractic.org.
Okay, and then they're
Great.
going to get in touch with you. There'll be some paperwork, and,
Yep.
then your schedule. And here's just, as you were talking about, pain and it not having to be inevitable, and pain from injuries. What about pain from growing older?
Yeah. Another sport.
Just going to throw that out
Another
there.
sport.
That's a hazardous
And,
sport.
yeah, it's a very
Yeah,
hazardous
it is.
sport.
It
And
is.
some things come up that maybe didn't come up a year ago.
Exactly.
And is there an option? Are there
Absolutely.
things that,
we
just
take
saying.
Medicare, Medicaid, and like we basically try to be very upfront about what it is that you're looking at, and I also try to be accommodating. Like, if you can't afford to do all the things, like let's do what we can on your budget. But yeah, it's still training for life. So
Yeah,
it's
well,
about
training
what do you do?
for quality of life, I think, is the thing. People assume aging is going to be inevitable and you're going to slow down,
Yes.
but I think there's things you can do, interventions you
Yes.
can do to be your best self for a longer length of time.
There are plenty. So I really try to accommodate, like, what's your goal for treatment long term, and what do you need out of this, and let's figure out how we get there.
We are down to
But we're out of time.
time.
Thank you so much for
Thank
coming
you.
on.
Thank you,
And
Bill.
I hope you'll come on again and do some more things about new techniques and
Absolutely.
breakthroughs in the field, because it's really pretty exciting.
Thank you. I would
right.
love to.
Okay, great.
Awesome.
Well, that's it. We'll see you next week on The Feed.
Bye, community.
My God, my